Hello, my name is Brett Huffington. I'm an intern here at Missouri Rural Health Association, and today we're going to be discussing different methods and ways that people can gain better access to necessary prescription drugs. One of the biggest issues facing prescription drugs is that people cannot afford them because they have little or no health insurance. So we're going to be discussing some ways we can combat that. For example, Missouri Drug Card, Medicare, Medicaid, and Section 340B. After that, we'll be talking about the future of prescription drugs and where we're headed so that people can have better access to them. So first, we have the Missouri Drug Card. Everyone is eligible to receive the Missouri Drug Card, but it's meant for people with little or no health insurance. So if you have the best insurance or no insurance at all, you can still receive the savings. You can get anywhere from 30 to 80% of savings on generic and name brand drugs. It's very easy to use. All you have to do is go to your pharmacy and present them the card to receive your savings. The card is accepted at over 86,000 major chains and pharmacies in Missouri. Some of these include Kmart, CVS, MedX, Rite Aid, Shop and Save, and thousands of other independent pharmacies. It's very easy to obtain. All you have to do is go to MissouriDrugCard.com to sign up and print off directly from the site. And then we have an example of what the Missouri Drug Card looks like. Next, we have Medicare. Medicare is ran by the federal government to assist with healthcare costs. It's mostly used for people who are at least 65 years of age or older, but it can also be used by people with disabilities or a family with that has a disability within it and they have very low income. Medicare Part D is the part of Medicare that deals with prescription drugs. It's an optional plan, meaning you don't have to use it if you do not want to. But when using it, you can save up to 70%, 75% on generic drugs when you're in the coverage gap, which we will discuss here in a minute. But first, the difference between generic and name brand drugs is that name brand, they're the first ones to come out with it and they have the patent on it for a certain amount of time. After the patent is up, then generic companies can come make the drug, which has the same ingredients, potency, and quality. It's just under a different name and is cheaper. There's three ways to sign up for Medicare. First, you can call Social Security at 1-800-772-1213. Next, you can apply online at Social Security's administration website, or you can go to your local Social Security office and sign up in person. So the coverage gap is kind of how the Medicare Part D works. You're first given an initial coverage limit, and during this stage, you're going to pay for the amount of drug that your plan states, and the insurance company will pay the rest. This will go on till there's a combined amount of $4,130. And the way this works is if a drug costs $100 and you pay $10 and the drug company pays $90, then the combined total is 100 onto your coverage limit. So then your coverage limit would be down to 4,030. Once you reach the limit, you then go to the next stage, which is the coverage gap, or it's called the donut hole. And when this happens, you will only pay up to 25% of covered prescriptions up to a total of 6,550. And this works the same way as the initial coverage gap or coverage limit. So once you reach this number, you bump to the next stage, which is catastrophic coverage. Here you will pay no more than $3.70 for generic drugs and $8.20 for name brand drugs. Next, we have Medicaid, which in Missouri is called HealthNet. This is state ran to provide insurance to people with low income. To qualify, you must be a Missouri resident and fall into one of these groups: pregnant, care for a child under 18 years old, have a disability or a family member with a disability, or be at least 65 years of age. And then you also have to fit into this table which shows household size and maximum income per year for that household size, and you must be at that or below it to be eligible for Medicare. So for example, if you have 4 members in your household, you must be at or underneath $35,245. Um, HealthNet offers a lot of essential healthcare services like inpatient hospital services, outpatient services, non-emergency medical transportation, physician services, family planning services, lab and x-ray services, and much more. In dealing with pharmaceuticals, they have a pharmacy program, and what the pharmacy program is they provide reimbursement for drugs for people that are eligible for the fee for service program. And what the fee for service program does is they pay your insurance company directly for the services that you are provided. There's several ways to apply for HealthNet. You can go online at this link. You can call them at 855-373-9994. And there's also another online application that you can print off and give them directly. Next, we have Section 340B. And according to the American Hospital Association, Section 340B of the Public Health Service Act requires pharmaceutical manufacturers participating in Medicaid to sell outpatient drugs at discounted prices to healthcare entities that give care to many uninsured and low-income patients. Entities that are enrolled can save 25 to 50% in pharmaceutical savings. Some examples of the entities that might be involved in 340B are healthcare centers, Ryan White HIV or AIDS program grantees, hospitals, children's hospitals, critical access hospitals, some specialized clinics like STD clinics, Title X family planning clinics. And then to receive 340B pricing, a patient must receive care from the healthcare facility other than the prescription drugs they're receiving. And the patient must also receive care from a healthcare professional employed by that 340B facility or one that 340B facility has recommended. And this is just a little visual to help explain how 340B works. If you have 2 people that go into a 340B enrolled hospital and one has insurance and the other does not, the savings that they are given from the insured patient will then go to the person that is not insured, so both of them are allowed to get care. And so now we're going to talk about the future. We have a new administration. It's a big change in ideals from the last administration. Joe Biden wants to lower prescription drugs and increase access to insurance and healthcare. We have a quote here from him. It says, "We pay the highest prescription drug prices of anywhere in the world right here in America today, 3 times what other countries pay." Some other things that Joe wants to do is he wants Medicare to be able to negotiate drug prices. He also has big plans to change the infrastructure of the healthcare system. He has allotted over $40 billion to expand access to long-term care and Medicare. And this is for families and other people that are on waiting lists to get Medicare, which is over 800,000. Here are my sources. I hope you enjoyed my presentation and learned something useful today. Thank you.